Perfect. Second one is we apologized, but unfortunately there is something in the Zoom updated versions which are creating problems when text on tab is used in the Zoom, then doesn't seem to be working very well outside of the Zoom. It's somehow the linking, it's not working as it used to be. So we apologize for that because we obviously tried our best to provide those different captions in different languages. We will make sure, we will take stock and we'll make sure next time it doesn't happen. Thank you. So first of all, let me to welcome everyone and everybody who is found the moment to join us. And I would like you to also welcome our speakers, Ariane Laplante-Levesque from the World Health Organization, who is Vision and Hearing Services consultant working directly there as technical officer. Mark Lawrence, who is the president of the European Association of Hearing Aid Professionals. Paulina Lewandowska, who is from Vice President of the Polish Association of Hard of Hearing and Cochlear Implant Users, SUITA. She is also a Vice Secretary of the International Federation of Hard of Hearing Young People. We've got also Nick Ted, who is himself a very creative hairdresser, spanning many years, and campaigner, hearing care, especially on the person-centered approach campaigner. And he also is a trustee of National Association of Deaf People in the UK. And finally, we've got Steinar, who is from the HLF, Norwegian Hard of Hearing Association. And he is a chief research on hearing care and hearing services in Norway. Welcome, everyone. Our first speaker is Ariane, who is going to kick off and set up the scene of what is happening around this the services and in the field of hearing care. Thank you, Ariane. The floor is yours.
Thank you, Lydia. Let me just share my screen. Are you seeing a full screen version? Yeah, perfect. Yeah. Lydia, you know, it was my pleasure to accept your invitation to support the launch of this report today that you and your association has prepared. And what I'll be doing is I'll be setting the scene. I'll be describing briefly the current state and the current challenges around ear and hearing care. I'll be also summarizing the main messages of the World Report on Hearing in terms of how to achieve hearing care for everybody. And before I get started, I want to say that the content of my presentation involved the work of a very large group of people, of course, from the World Health Organization, and I'm thinking mostly of Shelley Shada, who's leading this work, but also people representing many different organizations. And I know that several of these people and those organizations are here today. So thank you to all of you. I'm joining you from Copenhagen, Denmark, which is where the regional office for the European region of WHO is located. We know that hearing loss is on the rise. So here I'm presenting statistics that are specific to the WHO European region. That includes 53 countries of the European Union, of course, but much more than that as well. Also countries from the greater European area, as well as countries from Central Asia. And in those 53 countries, on average, 20% of the population lives with some degree of hearing loss. We expect that unless action is taken, this share will rise from 20 to 25% by 2050. We also know that investing in ear and hearing care, it's important for two reasons. First, it's important for a good functional outcome of those that are at risk or people who have ear and hearing problems. And we also know that it makes sense to invest in ear and hearing care because it's cost effective. At a societal level, we know that a lack or inadequate ear and hearing services comes at a very high cost, and that's mostly because of the loss of productivity and the social isolation that results or that can result from untreated or poorly treated hearing loss. In the WHO European region, hearing loss cost approximately 225 billion US dollars, and that's every single year. So that's basically the cost of not addressing hearing loss. When we address hearing loss, we make one step towards making sure that everybody can realize their full potential. And addressing hearing loss doesn't necessarily have to be expensive. In the WHO European region, it would cost less than $1.20 on a yearly basis per capita to be able to provide ear and hearing care services to people who need it. And every dollar that we would invest would result in a return on investment of $30 over a 10-year period. So that's why we really talk about this being an investment rather than a simple expenditure. Those numbers are specific to the WHO European region. And if you want to have global numbers, you're also welcome to have a look at the World Report on Hearing. We know that access to ear and hearing care is currently far from a given. And here I want to show you the relationship, the association between access to ear and hearing care and where one person lives. This figure is focusing on people with disabling hearing loss. And for WHO, this refers to someone who has a hearing loss greater than 35 dBHL, decibels, in the better ear. Among those who have a disabling hearing loss globally, the vast majority live in low and middle income countries. And if we take just one single indicator of the success of service provision, we can look at the percentage of people who need hearing aids versus their actual use in the population. And we find that there is a gap of over 80% globally. And you can see on the screen that the gap ranges from 91% in low-income countries to basically 75% in high-income countries. So in the best case scenario, we're saying that about 1 person out of 4 who needs hearing aids are actually using them. And I just want to make clear that I very much welcome the report on the state of hearing aid provision in Europe being launched today. And Lydia, I know that you'll be describing the results very shortly. I just want to sort of raise the point that the data arises from 21 countries, and these are all high-income countries. So with this slide, what I want to say is that the main findings of the report are likely to be really the tip of the iceberg. So this is perhaps the sort of sad news, but I also have some good news, and it is that it is possible to have good hearing across the life course. And to address the challenges that are faced regarding hearing care and to move towards a path of everybody being able to have coverage for the health needs that they have, so that nobody's suffering financial hardship because of health conditions. Countries really need to adopt an integrated and people-centered approach to ear and hearing care, so that ear and hearing care doesn't function its own little bubble, but it's really integrated into strong health systems that the countries are providing. And the goal is that all people who are in need have equal access to quality services and an environment that makes sense to them and that is supportive. The role of WHO, as many of you know, is to provide technical support to countries, which we like to call member states, in helping the member states securing the highest possible level of health for their populations. And to do so, WHO is offering tools for planning, for training, for advocacy, for awareness, for surveys, screening, rehabilitation, for all sorts of health conditions, including hearing loss. For hearing loss specifically, this includes tools such as guides for situation analysis when a country wants to better understand what their ear and hearing care systems look like, training manuals for professionals, whether it is people that are focusing on ear and hearing or people that are more generally trained health professionals. And there's many more publications that are widely available on the WHO website. One central publication is the World Report on Hearing. It was launched in March last year, as in 2021. It's a very comprehensive resource, as many of you know. It really frames hearing as a priority within the public health agenda. It recommends the integration of hearing care into health system, proposes cost-effective interventions, describes the return on investment, and suggests also targets and indicators for countries that are improving their ear and hearing services so that this way they can monitor their progress. World Hearing Day is a global advocacy campaign. It takes place yearly on the 3rd of March, so 3rd of the 3rd, and it calls for action to address hearing loss. And the goal of World Hearing Day is to raise awareness, to advocate, to encourage behavior change, and also to stimulate partnerships. Make Listening Safe is an initiative that has a vision of a world where people of all ages can enjoy listening in their leisure time without risking any hearing damage. Make Listening Safe has forged successful partnerships to be able to achieve their goals of advocacy, of creating global standards for safe listening devices, and to also create a regulatory framework for venues that provide safe listening. Finally, the World Report on Hearing, the World Hearing Forum is a global network of stakeholders that are committed to promoting ear and hearing care worldwide. And these members of that advocacy group will usually be committed to working mostly regionally or nationally to support their countries in addressing ear and hearing. So overall, it's about 3 main actions. So preventing ear and hearing conditions. It's about identifying as early as possible and having appropriate and timely care and rehabilitation, which the report that we'll be discussing shortly focuses on. The World Report on Hearing goes further and it describes 7 evidence-based interventions, and their acronym makes the word hearing so that it's nice and easy to remember, and it's right here. And the idea is that countries can then determine which of those interventions best suit their needs, and then by creating a prioritization exercise and then picking in those, and I won't go into the detail of those, but I think some of them are quite self-explanatory. So hearing screening and intervention, thinking of screening at all ages, thinking of having early identification and management of ear disease, access to technology, which again, today we're focusing on with access to hearing aids, but it could also be other technologies such as implants or hearing assistive technology. And then I won't go into the details of the RI and G, but I'm sure that many of you have a good idea as to what they can involve. And I can just say that the G is about making sure that all stakeholders that are relevant for those discussions are involved. And so thinking about multi-stakeholder action. And this happens through collaborations just like today. So thank you for the European Federation for facilitating this event. And back to you, Lydia.
Yeah, I got muted myself. Thank you very much for the really very good presentation. It's amazing how much has been done since the World Hearing Report, and especially since the World Hearing Forum has come together, and there is a lot more coming. So I'm very pleased to see this report. Now I will share my report. Okay. Can everybody see my just I need to get slideshow. Just trying to get myself set up with this. Yeah, it's now finally technology listening to me, I think so. Yep. Can everybody see the slides? Yeah. Okay, thank you. So let me launch today the Hearing Aid Reimbursement in Europe 2022 report. Now, and the slides are not moving. Oh, first of all, let me introduce the European Federation of Hard of Hearing People to those who have just heard about us or did not really hear much about us. Our goal is Europe where hard of hearing people can live without barriers and have the opportunity to participate in all levels of society. And we were funded in 1993, represent interests of now around 57 million hard of hearing Europeans. We realize our vision through actions, publications, projects, but also by being stakeholders directly with the European Commission. And United Nations Convention on the Rights of People with Disabilities is our foundation for all our work. And we currently have 28 national members covering 21 countries in Europe. I would like to introduce methodology of how we have come about to seek the question, to seek the data, but also to provide the report. First of all, we have sent a questionnaire based on similar answers as in 2018 to all our members, but also we sent it to the European Association of Hearing Aid Professionals members as well. Thank you very much for Mark Leverage for facilitating that. And what we did, we added extra 2 questions to make sure that we have fuller picture of what is happening. Those questions focus mostly on adults with hearing aid reimbursement levels as part of hearing care provisions. And the reason for that is because in general, usually children are quite well provided in many countries. We received 21 responses, one of them from 18 European Union member states responded, and 2 from outside of EU, 2 or actually 3 probably. So I think I made mistakes. So if I'm wrong, then please forgive me. We analyzed all of those responses and we grouped them during 2022. During 2022, we also kept going back and forth to ensure that the peer review takes place, and peer review has been done by our members, but especially by the hearing care professionals support, with their support. So what is happening in Europe? What is the state? We had 2 new entrants, Spain, Malta, few new entrants. Spain, Malta, Romania, and Luxembourg, which is great. We also have picked up an interesting case of France, where previously France did not do very well in our state of reimbursement. This time, a higher reimbursement for class 1 of hearing aid, but meets new requirements of 950 euros and nearly is now provided, and it's nearly everybody in France can get the hearing aids free of charge. And next to this, there is also another class 2 of hearing aids. And then usually you need to pay up. So what are the findings of the report in more detail? Coverage of hearing aids costs vary in different European countries from 25% to 100%. Some countries provide hearing aids free as part of national health programs. In some countries, users need to pay full cost first and then apply for reimbursement later. This is detrimental because it stops people from actually even approaching and asking for help. Majority of the EU countries do have the minimum hearing aid upgrades, which is every 5 years. And the exception is, of course, for children, because children are much faster developing and they require different rehabilitation levels. And the significant change of hearing loss is also a trigger for earlier upgrade. In some countries, hard of hearing people have no possibility to have a freedom of choice of a device due to lower reimbursement or due to procurement rules, or because simply the way the national framework works is big hospitals or big clinics just provide 1 or 2 maximum devices for a person. In some countries, the reimbursement policy does not match the reality. So when we actually looked at some of the responses, and when we asked some of our members, when we had different responses actually. So that is really interesting. And I think today the panelists will be able to provide more information. But significant hurdles remain with bureaucratic systems, because sometimes it's not just in one place where you can receive support with hearing aids. It could be lots of different social cares and lots of different areas you could look at. But actually, it really complicates things more. And in many countries, like mentioned before, children are supported well. However, adults and senior citizens are not. And now we are talking about Europe. European Commission has a wonderful plans for flagships on education, employment, and support of freedom of movement, which allows us to work and study anywhere in Europe. So we can really do much better to allow hard of hearing people to enjoy all of those freedoms and initiatives fully. We would like to bring also a notion of the cost of hearing loss and cost of the interventions, which Ariane has mentioned earlier, but also the legal requirements and legal instruments we have in Europe. Number one, Article 25 mentions health and the ensuring that we do not get disabled more than we already are by the UNCRPD. So that's global. Article 35 is the healthcare, a charter of fundamental rights in the EU. Everyone has the right to the quality, the highest attainable quality of healthcare. And something. Provision of hearing aids. Okay, so that, sorry, my keyboard not work very well. Okay, and another one. So these two most important provisions are one global, one European. And with €1 spent on hearing care by EU government, we actually get €10 back in return, which is reduced overall cost of untreated hearing loss, which cost European Union 178 billion per year. And that comes from the economic report written by Dr. Lawrence Hartman, which was, by the way, influential in the change of the situation in France. But accessing hearing aids themselves is not enough. Quality of hearing care is just as important. So what we believe, and in our report and recommendations, part of it, but hearing care system should allow the device choice based on World Health Organization ICF classification, which is international classification on functioning and disability. Because the choice and our aspirations matter. The system should allow professionals time to get to know their clients and what is the most important to them, the employment, the goals and hobbies. It matters to all of us, but also if the professionals are not given funding to spend more time, then we simply cannot do it. And the sessions need to be offered to show different communication strategies and assistive listening devices, because that's part of adjusting. And as you can see in that quote, and that quote is taken directly from the World Report on Hearing, two people with the same audiogram configuration can have very different everyday hearing-related difficulties and experience. And those of us who are hearing this webinar today and who have hearing difficulties, we know all too well that this is the truth. So investing in person-centered approach makes sense, both economically and socially. Prevention of hearing loss and quality of hearing care should be an integral part of national action plans on hearing loss. Person-centered approach, supporting individuals, brings better results for us all. And addressing personal well-being as well is multidisciplinary support effort, because in the end of the day, hearing is not just getting hearing aid on the ear in the same way as my glasses. I'm sorry, my glasses provide me with instant better eyesight, but unfortunately not hearing. It's not the same. An engagement between hearing care professional and users organizations at national as well as local levels need to be established. Replicating similar collaboration, which we already do in European level between the hearing aid professionals and hearing care professionals, hearing aid manufacturers, and the European Federation. Also, another quote from the World Report on Hearing: harnessing expert knowledge, including those who are hard of hearing representatives, is vital for the implementation of the World Report on Hearing. So we call to action. Let's just pause for a minute. We just heard Ariane speaking, and now me. The investment in quality of hearing care as part of universal healthcare provision is a sound investment. We seem to be repeating ourselves. So EFHOH urged European governments to pay attention to the crisis of cost of living, which disproportionately affects hard of hearing citizens, some who are unable to afford hearing aids and assistive devices, which are essential to hard of hearing people to access and maintain education and employment opportunities. And we also urge the government to follow recommendations of the report and also to set up action plans on hearing loss. Because after all, no one should be priced out of the opportunities because they experience hearing loss. But don't forget, some hearing losses are best treated with alternative or additional devices such as cochlear implants, bone anchored hearing system, and assistive technology. So to give you just last word, 3rd of December is the International Day of Persons with Disabilities. So what is our message? We would like to see an inclusive society and policies for hard of hearing people, which include quality of hearing care and hearing technology, rehabilitation, accessible society and accessible communication, and of course, hearing-friendly policies. Let's leave no one behind. Thank you. I hope you have received quite a good overview of our messages. So I think we were very much covering each other and even repeating ourselves, but sometimes repeat needs to be repeated. And I would like to start now with the questions. So, and the panelists. So first of all, whoever would like to ask any questions, please put them in the chat room. Kaveh and Jonathan will be facilitating the questions from everyone else in this meeting. Let me start with Mark Lawrence, because Mark Lawrence has participated so actively. And thank you so much for your active participation in getting this report published and to be reviewed especially. So I have two questions for you. You and your members participated in this review. What are your initial thoughts? And number two, what needs to be done to improve the situation in Europe? Thank you.
Well, thank you for those questions, and thank you for organizing this report, which is very important to us, and also to get the numbers right. So what we have seen, it's so important to join forces, that hard of hearing people and hearing care professionals need to join forces and need to inform each other. It was surprising that it wasn't always easy in each country to get the correct information on who is entitled to get hearing care, what is the cost of, what is the reimbursement, what is the result. And that is showing that also on local level, what we should do, like what we do today, joining forces with you, right? We should also do that at the local level, because the hard of hearing people are the first that should get well informed. To give you an idea, in Belgium, 69% of the people with self-reported hearing loss don't even know that there is a reimbursement. It's crazy. It's a little better in Denmark, but it's still less than 50% of people who report hearing problems themselves who don't even know that hearing aids are covered. And by the way, in Denmark, they're normally even free of charge. So that is kind of surprising. The other aspect is we also need to involve the user much more. Person-centered care shouldn't be a hollow phrase. It should be something which is done in reality, because then we see that if you want people to live a full life, to get the full potential, the first thing we need to do is to listen very carefully to all the people's specific needs and objectives. That's why, by the way, we have 2 ears and 1 mouth, so we should listen twice as much as we talk, and that's important in hearing care as well. So that is so key and so important. So, and I'm very happy that you and Ariane repeated that hearing care is not a cost. Hearing care is an investment. It's interesting to see that Ariane's numbers are much more positive than yours, but I know they come from a different source. But WHO, Europe, and European region, you see it's even an investment of €1 or $1 returns into 31. In these times of crisis, it is much better than any bank account and any other investment you can take. Let's just do it and go for it. This investment makes sense. Now, what about improving access? And there I want to get back to the Eurotrack numbers we've seen, because it's kind of interesting to look at the uptake or how many people are using hearing aids in different European countries. Worst of all, by the way, in uptake is Poland. Only 18% of the people who report hearing problems have hearing aids. Followed by Belgium, a country where I'm living, and also the center of European Parliament. Only 34% of people with self-reported hearing problems have hearing aids, followed by Italy with 35%. We estimate that the reasons can be sometimes lower reimbursement, but another signal is the average hearing loss you need to get access to hearing aids and hearing care. For your information, in Poland, it's on average 40 dB average hearing loss. Belgium, 40 dB average hearing loss. Italy, 55 dB average hearing loss, which is crazy. And we see that in most countries who are very successful, the average hearing loss you need is 30 dB, which is of course more realistic because you do start having problems, definitely in noise, with that level of hearing loss. And then you see also the upsides, which are the countries doing better. The number one is UK, followed by Denmark, followed by Norway, where the uptake is more than Ariane's numbers because they have state-supported systems free of charge. And there the uptake is about 53% up to 49%, which is very high, which is positive. Directly followed, by the way, by France, the country you mentioned. They're now in the top 4 of countries with the highest uptake in Europe. So their 100% santé, as they call it, 100% health, is working. Now, the flip side is you only don't need to look at how many people have hearing aids, but how satisfied are they with these hearing aids. And then we see a somewhat different story. Then you see that the lowest satisfaction you find in Denmark, Norway, and UK. Typically state-supported systems with fairly little freedom of choice. And we think that the involvement of the user, the freedom to choose, could be an important factor in this fairly low satisfaction rating. And then the upside, which countries do we see the highest satisfaction? And there we see Switzerland, France, Belgium. So you see that in fact, freedom of choice seems to work. We also see that although you may have a low uptake, you could have high satisfaction, but we need to combine both. It is so important that people feel involved. They feel that their solution fit for their needs. And that's why we need to invest in doing more things like this. So very happy with the report. I hope it will help us, and I'm sure it will help us in advocacy, lobbying with ministries of health, with others. And by the way, we're already planning that in Belgium to show your great report and to show why Belgium is doing so bad. So we have to do better, but we need to do it in different countries. So hopefully we can join forces. And by the way, after this session, we have a meeting with the Hard of Hearing Association from Antwerp, a Belgian association, and this will be #1 on the agenda. Let's join forces to make sure access to hearing care gets better, but quality care, person-centered care involving the user to the fullest. So thank you so much, and sorry for my long explanation on your two questions, Lydia.
Thank you very much, Mark, and thank you for all the cooperation you continue to do with EFHOH. I understand that you will have to drop off earlier. So we have our colleague, another panelist, who is from Norway and who has prepared a presentation. And instead of asking questions, then I will allow Steinar to present his presentation, because it's interesting you're talking about the state-funded national care. And Steinar,
yeah,
floor is yours.
Thank you very much for the opportunity.
Do you want to screen share?
Yes, can you share my presentation, or should I do it from here?
Do you have your presentation ready?
It should be ready. Roa will assist me to open it up. So, yeah.
Perfect.
So listening.
Floor is yours.
Yeah, just have to start it up here. So, yes, thank you. First of all, I'm going to report from the Norwegian reimbursement system situation. First, about the system. First of all, it's the Norwegian system is healthcare system is based on the Nordic welfare model, and which means in our field that there is a political consensus for high-tech or high-end hearing aids and services reimbursement. So that's the baseline for offering the Norwegian population good products and also good services. When it comes to the way the Norwegian state is operating, it is always has a very well worked out technical specification for hearing for high-end hearing aids, and that is the base for the hearing aid companies who has to compete to win contracts for selling hearing aids in Norway. This gives the volumes here is annually is more than 100,000 hearing aids, and the total worth is around 55.2 million euros annually within in this system. We have in Norway, I have to say that we have a population of 5.5 million inhabitants, and we have 35 hospital clinics and a bit more than 100 ENT clinics who is on contract with hospitals for giving out hearing aids and also offering services. The status, if I'm going to divide between products and services, it is as follows. When it comes to reimbursement for technology, also hearing aids, but also assistive devices, that is very okay. It's for the most, it's free for the users. As it was said from the previous speaker, the knowledge of reimbursement is not so well known. It's according to Eurotrack, it's on 34% of the population knows about reimbursement, that the hearing aids and hearing devices are free. When it comes to reimbursement for services, that's partly okay. And just to address the previous speaker, and this is an ongoing battle for securing that the high-end technology also is accompanied by good hearing aid services for motivation and learning how to use it, also involvement of families, motivation, and in the end also rehabilitation. That's an ongoing struggle. My organization, HLF, is not a big fan of privatization, as the previous speaker was addressing as a solution. I was sensing quality is also possible to promote within a publicly financed or reimbursement system. The privatization is not necessarily the only solution for securing good services for a wider population. And that this is what is a struggle now within the Nordic countries. And there's could be a seminar in itself to see the variation between Norway, Sweden, Denmark, and how we are struggling to secure good services and not only reimbursement for hearing aids. So there's two sides of the same coin. So now to use and satisfaction in Norway. First of all, it's according to Eurotrack, the average daily use of hearing aids in Norway is 7.6 hours. No use or maximum 1 hour daily use. This is from a study of a big public clinic, 26%. That's also is a reflection of challenges within the services in Norway. And as it was said before, the overall satisfaction in Norway is, I would call it okay, but Norway is still number 11 in Europe, Denmark number 15, I think. So we're not best in the class. But it's so in a way it's a dilemma here, because the hospitals are being challenged not only by a hard of hearing population who needs services. There's many other groups who need services. So this is a fiscal debate on a state level. It's the population is getting older, and that costs money. Of course, it also has a beneficiary side to offering services and products, but that also has a financial side. Challenges for the years to come in Norway. Capacity is a big issue in the specialized clinics. The queues are lining up. It can be up to 1 year waiting list, and now also the private clinics, which is associated with the hospitals, is reporting waiting lists. That's a new situation. Another challenge, but also a big possibility, is follow-up within the clinics, but also on the primary health level for education, and also involving the family for using and hearing aids, but also additional products. We also have a challenge within the specialized rehabilitation services, where I think this is an area where it's sadly it's very little services hard of hearing can get help from in Norway as it is today. There's some exceptions, of course, but all in all, it's that's a area that could be possible to achieve better results. Then last but not least, there's a big need for competence on hearing in local non-audiological health and care services. It's astonishing how little other healthcare professionals knows about hearing, and that gives very for many, especially elderly, this gives them unnecessary problems managing their everyday life and being in communication. and also being able to give feedback needed to find out what they need. Dementia is also a issue in this circumstance. That was very brief Norwegian report. Also made this presentation as as a poster if that's wanted for later on. Thank you.
Thank you very much, Steinar, for the presentation and showing what the situation is like in Norway. And as we know, sometimes people would say, oh, it's wonderful. In Scandinavian countries or wherever, they have everything. Yet you bring, there are still underlying challenges. So thank you so much for sharing the situation in Norway. If anybody has any questions to the speaker, please write them in your chat room. Now, I would like to bring Paulina, especially since Mark Lewrens mentioned Poland today as well. So Paulina, I have two questions for you. First of all, because you are still classed under the students' reimbursement system, because you are still studying, you experience different level of reimbursements currently. But what are your points to make when you move onto the adults reimbursement? First of all. Secondly, and somebody say something? No, okay. Because how the differences between the child and adult especially affect the uptake of hearing aids in Poland, and also the fact that Polish system is very fragmented. And does the system actually work for users? So floor is yours.
Okay, thank you very much, Lydia, and thank you for inviting me here too. So let's explain one thing, that I am, according to the national health system, I am not anymore a student. Yeah, because you have to be no more than 26 years old. I am a little bit older than. So in general, the system affects me a lot right now, because right now I have my hearing. I think that I have like 4 years my hearing aids, and I can feel that I need a new one. But because of the system in Poland, I have to wait few more years. But okay, I'm gonna answer to your questions from the beginning. So I'm gonna explain you how does it look then comes to the reimbursement rules, because you have to know to understand that first to be able to understand the effect that might be to the person. So in Poland, it's possible to apply for a hearing aid reimbursement from 2 sources. And whether you get money to partially cover hearing aids expenses depends on a few factors. And I will just only mention the most classic situations, because it's very fragmented, so it's very difficult. It depends on the situation. It depends on the factors in general, on your life situation too. So firstly, you can get support from the National Health Fund, and there is a little change. Then we want to move to the report, because just a few weeks ago, we got the information from the government that the reimbursement will be increased a little next year, from the next year, but still it's not sufficient. And so how much a person gets really depends on several factors. First of all, it depends on the age, as I mentioned. So if you are a child or a young person up to the age of 26, you will get around 1,200 euros for 2 hearing aids. Yeah, and then you can apply for this money every 3 years. So it's okay. In this case, your hearing loss also must exceed 30 decibels. So this is the rule that you have to fulfill to be able to get that hearing aid. Yeah, but the problem is when we when it comes to the person who is over 26 years of age, because first of all, you must have a 30% deductible. So the actual reimbursement from the National Health Fund for buying 2 hearing aids then is less than 450 euros. So you have to pay from your own pocket money to be able to buy a hearing aid in general. And the reimbursement is every 5 years. So not every 3 years, like in the case of the kids, but every 5 years. And also the hearing loss must exceed 40 decibels. So 10 decibels more than in case of a kid. And also there is the second source of reimbursement, which is the state fund for rehabilitations of disabled people. So this is the official name, not mine, that I translated. And in order to receive money from them, again, a person must meet criteria such as having a disability certificate, having an application approved by the National Health Fund. So first you have to apply for the National Health Fund funding, and then you can apply for the money from the second source. And also it's also important the income that does not exceed the amount set out by this the state fund for rehabilitation of disabled people. So if you are a rich person, I doubt that you're gonna get any money from the government. And the amount of reimbursement varies and is determined separately for each part of Poland, so voivodeship, for a specific calendar year. So in the case that there is no money left, like in the end of this year, you would probably have to wait for the next year to get money for the hearing aids. So to answer the question, how does this affect Polish people with hearing loss? So you can just imagine how a person who is turning 26 feels. So first of all, that person is not only is there, for that person is not only that there is a less funding for hearing aids, which also involves paying a huge amount out of their own pocket, of course, because it's much more. The expenses for hearing aids is much more than you can imagine, that it's not that you can pay every day. So also, but the funding is every 5 years in that case, so not every 3 years. So it's a huge difference. And also what's more, this person has often just graduated from university, because this is the magic age of 26, or that person may be freshly into the job market. So this is such a new environment to that person. So it's really important to provide support to that person. But what happens if there is no hearing aid to that person? Also, therefore, such a person is deprived of good quality of life and a good hearing, thanks to hearing aids, just because they are over this magic age of 26. So especially if they cannot afford to buy new hearing aids. And those hearing aids, what happened also when hearing aids were out over time, because the hearing quality is worse in hearing aids after several years. So this means that you have to get new hearing aids to be able to fully participate in a social like life. And what's more, I also very often hear from my friends, hard of hearing, and the people who wear cochlear hearing aids, they mention that they change their hearing aids not every 5 years, but even every 7 or 10 years, just because they simply cannot afford it. So such a person simply feels cheated, let's say that, because the state supported the person when they were a child, when they were a young person up to the age of 26, because the state thinks that the development of that child and the young person is important. It's a critical moment also for rehabilitation, so that the child and young person can function normally in an adult life. But what happened next? I believe that every person who has hearing loss should rehabilitate or their life. So it's not that you have 18 years old and it's finished. No, it's like full work every year. So, and also suddenly these benefits are taken away from this person. So if that person is not able to pay for the hearing aid, that person has to buy hearing aids for a lower cost. So that it's might not be sufficient to the hearing loss of this person. So the quality of life is not as good as it used to be. And I think that this is an answer to the second question, but I want to point out that still there is a need to change the reimbursement system in Poland in general, as this is insufficient, especially when it comes to supporting people who are adults. And if they don't meet the conditions that are set by the state fund for rehabilitation of disabled people, or if there is no money left to support a person wishing to get the support to buy new hearing aids. So this means that in almost every case, a person who has a hearing loss and wants to buy a new hearing aid, they have to pay from their own pocket money because it's not sufficient for them. And also, as Mark said, a proper hearing care should not be a cost, but as an investment, which the Polish government and the governments of other countries should understand too. Thank you.
Thank you very much, Paulina, very for bringing a different outlook with what is happening in different countries. We had Norway, now we have Poland. To answer your note about Poland, yes, we are aware that Poland from January 2023 is increasing. We know it's not enough, but it's increasing the reimbursement level. But for this report, we are keeping the same data because it relates to 2022.
Yeah.
Thank you. We are running a little bit late because we started a little bit late for all who are with us. And I'm just asking Kapshina if she's okay to stay a little bit longer with us.
Yes, of course.
Thank you very much, Joanne. Very much pleased that you are able to do that. I appreciate it. So let me to bring you now to Nick Ted, who is from UK, from England. And he's working in a very, very fast and paid environment. Being a hairdresser, it really requires lots of skills. And you have had and both access to national health services as well as the private services. And you are very outspoken for campaigner for person-centric principles for hearing care services. So could you say a few words about why it's so important and what difference it makes for you? Thank you.
Okay, well, hi everyone. Thanks, Lydia. I've had a hearing loss for 35 years now, and I've been a hairdresser for 40 years. A hairdressing salon environment is about the worst possible environment you could get for people who are deaf or using hearing technology. The surfaces are hard, there's background noise, music, hair dryers. So I can really put my hearing aids to the test. But I think, what do I need for me to be supported by the hearing aid provider? I can talk to you about my journey now. I'm in a really good place. I know what person-centered care is, and that's probably only been for the past, let's say, 5 years. One of the biggest things for me is not being aware that I could have used a T-loop, not being aware that there was Bluetooth or the predecessors to Bluetooth for me to use external microphones. What I've had to do for a good 30 years is find my own way through a jungle, which was a combination of the National Health Service in the UK, where I got one hearing aid, even though I've got hearing loss in both ears, through to, you don't want to know what I've spent on hearing aids over the years. I think I could have a fleet of Porsches, the amount I've spent so far. I'll tell you where I'm at right now, which is a good place with my hearing loss. I've got settings which are for speech in noise, which is ideal in a salon. Comfort in noise is also a really good setting, which for years I went without. And then, like I was saying, the additional technology. I don't anymore work on clients in the salon because I own 3 of them and I'm the boss. I visit them. But the microphones were absolutely essential for me, and I didn't know about them for years that they were available. I think technology aside, what would have really helped me from the hearing aid provider was what I call hearing rehabilitation. It's been mentioned a few times today. So some of those things are about being self-confident. Obviously now I'm in my 50s, I'm much more confident with my hearing loss and getting my needs met. But I think stating my needs, self-advocacy, tips for communication, and how to educate other people for me to meet my needs. I thought my hearing aids were going to be like a magic wand that would fix everything, but so did all my customers in the salon. You know, the usual questions like, have you got those things switched on? This is a massive thing for me. I think people still think that hearing aids are like putting a pair of glasses on. So it comes down to education. I think this is why we don't get the funding. It's because people still don't understand hearing loss, and they don't credit it as a disability either. Another thing for me that I've learned as well is in my salons, we have quite a lot of soft furnishings. I make sure we have curtains and cushions, and there's some furniture which has got soft fabrics on because they absorb the noise and it makes for an easier listening environment. So it would have been good to have been privy to some of that information. Also, I think community has been a massive thing for me with getting the right stuff that I need with my hearing technology, mixing with other people with hearing loss. It would have been nice to have been pointed in the direction of some support groups. And again, I'm in that position now. So the second question that was put to me was about what are the most important person-centered care principles. So basically, I would say from a hearing professional point of view is somebody that partners with me, somebody that asks for my input and listens to my priorities in addition to the test results on the audiograph. I think being asked to keep a diary of when I've been able to hear poorly or when I've heard really well in different environments. And somebody who builds my treatment plan with me and empathizes with my journey. Another big one is when I go to the audiologist, I think the environment is really important. The National Health Service in my city, the waiting room, everybody sits there very, very nervous, on edge, waiting for their name to be called. It doesn't seem to me to be a very hearing loss friendly environment. So I think that flexible appointment making, a quiet and well lit environment, relevant literature in the waiting area, and teaching the team that work there to have hearing friendly procedures. And a big one for me is having the information presented to me in writing in an email afterwards, because if I've attended the appointment by myself, when I receive the email later, I realize how much I actually missed without realizing it. The audiologist I've got at the minute, I'm fortunate enough to be able to pay for private hearing aids. So I use the National Health Service ones as a backup, and I get free batteries because of that. Thankfully, they're the same as my private ones. But I think it's nice if I've got somebody that understands creativity like Bluetooth, and they share their favorite apps and innovations with me. And it's very, very important for me to still have T-coil technology as well as Auracast and Bluetooth. I can't live without those. I use them all the time. So even though I'm going to stream music from my mobile phone, take phone calls, use a portable Bluetooth microphone, I still like a T-loop because I find when they're working, they're crystal clear. Also for me, having an audiologist or hearing aid provider who thinks beyond the technology. So in other words, sharing the best practice conversation tips for better conversation, teaching me to be a better listener. It's taken me a long time to learn how to do that, and helping me to manage hearing loss, exhaustion and fatigue. I always used to think there was something clinically wrong with me until I started hanging out with other people who've got hearing loss. And then I realized that it's pretty normal to need a nap in the afternoon. So looking back at my career, I think I would have booked out an empty space in the afternoon just to have a rest from listening. Again, I've had to find this out for myself from trial and error, and it wasn't until I met other people with hearing loss I learned it was normal. Self-advocacy has been a massive thing for me, and I actually think it's a skill set. I think it's like something that everybody needs to have. And again, to dispel that myth that just putting the hearing aids in is going to fix you. I think that's only, for me, that's 50% of the fix. I mean, don't get me wrong, I wouldn't be without them. But one of the biggest things for me is that skill set of self-advocacy and being confident. Like I said earlier, recommending hearing loss support groups and organisations in the area. But I think the final thing would be really, what are my responsibilities for the hearing aid provider? And that would be sharing my hearing loss story and struggles, again, by keeping a journal, coming armed with the facts, and also being patient is a really difficult one for me because I want it now. But I think it takes time to build a relationship with an audiologist. One of the problems I've had with the National Health Service in the UK in the past is they've said to me, right, your hour is up. And I said, wait a minute, you've not paired my microphone yet. And they said, it doesn't matter, we haven't got time, off you go. So I was sent away with very little person-centered care, but also unaided. So this is another reason for going private. I'd rather spend the money on my hearing technology and being able to go to that clinic the same day if I want to. I think that one of the biggest things is teaching other people what I know too. And I think it might have been a nice idea with the private audiology clinic if they did have some nights where some of the people that have got hearing loss can come together to share some of their tips and advice. But the biggest one for me is community. Mixing with other people with hearing loss has been huge for me in my hearing loss journey and coming to a place of acceptance. I hope that answers the questions, Lydia.
Thank you so much. It's been really nice to hear the overall experience of person hearing loss and your requirements and person-centered approach. Thank you so much.
Thank you.
Audiologists in this webinar are listening carefully. I guarantee you that. Now, if I could, because we are running out of time, because we have started very late and our lovely support, technical support, also needs to drop out soon, we will not have the questions from the audience unless you ask some questions now in the chat. So please contact, and speak to the presenters. And I will leave the last word to Ariane to sum up this evening and to sum up the messages. Thank you. Floor is yours.
Thank you. And I will make it short as well, because I do realize that I'm sort of in the way of probably you enjoying your evening. And thank you really, Lydia and colleagues, for bringing together different speakers, different viewpoints that I think were very rich, were complementary, and is definitely giving me a lot to think about. I'll just pick up on two main things. I want to say thank you to everybody for highlighting the gap in services, just like the report does, but also giving some good examples of things that work, of providing solutions, because it's one thing to describe the problem, and it's also even better when we come with some potential solutions. I'm not pretending that there's a one-size-fits-all solution for all countries, for all kinds of hearing loss. We've already discussed that, but it's good to at least have some inspiration of examples that we can look forward, that we can look up to when thinking of how to improve the current state of affairs when it comes to provision of hearing aids and other ear and hearing care. That's the first point I wanted to make. And the second point, thank you to everybody for highlighting the importance of bringing everybody at the table. This is a huge undertaking. We need all the energy. We need all the good ideas of everybody that's involved in improving ear and hearing care. So I'll leave it on this.
Thank you so much. That was a very succinct and very well kind of wrapped up event. So thank you very, very much for doing so. So can I please give applause to all our speakers here today? Let's give them a hand. Wonderful. And also a hand to our wonderful technical support, Kavenori and Jonathan Björk. I can't say that your name, sorry about that, Jonathan. Show up your faces. Yeah, and Jonathan. Yeah, they have been working very hard behind the scenes and making sure everybody is, catered for and communication is correctly done. Can I ask you all to say one word, one sentence, sorry. Leave no one behind. Come on, switch on your mics. Just make one unison. 1, 2, 3.
Leave no one behind.
Behind.
Thank you very much. And thank you so much to Joanne, our captioner, who has been wonderful. And she tried very hard to battle with technology, which did not want to batch today. What's one of those things? Thank you so much. And thank you very much for everybody. And we have the recordings of us who have missed it. They will be able to receive it. And please check the report, which is on our website now. Thank you very much and bye-bye. Have a good evening.
Thank you.
Thank you. Bye.
Thank you. Bye.